Uganda Catholic Medical Bureau was formed in 1934 under the auspice of the Uganda Episcopal Conference as its health department. Uganda Catholic Medical Bureau is the health office of the Roman Catholic Church in Uganda and the technical arm of the Health Commission of Uganda Episcopal Conference, carrying out its day-to-day operations. At the conclusion of this year's annual health assembly in Nsambya, under the theme Leveraging Technology and Innovation to Enhance and Deliver Quality Patient-Centered Healthcare in the Catholic Network, this was aimed at reaffirming solidarity of its members to provide an account of the performance of the Catholic health services in Uganda for the year just ended. Speaking at the conclusion of the Uganda Catholic Bureau Annual Health Assembly at Nsambya today, Dr. Sam Orach, the Executive Secretary, Uganda Catholic Medical Bureau, highlights the significance of a patient-centered health system.
For years, we have provided health services to patients, but increasingly it is important that we involve patients in the understanding of the diseases that they have or the conditions for which we are treating them. And with that understanding, they should be involved in the process of making decisions on how they are managed, what they are treated with. And they need to understand even the treatment that they are getting. Being patient-centered also means that we provide services in a way that gives dignity and gives satisfaction to the patients. The processes should be easy, should be simple to understand, but also easy to follow, should not provide huge burden on people. In other words, it creates efficiency in the way we provide the services.
Technologies offer an opportunity to improve health outcomes, but this will only be fully tapped with stakeholders' engagement. Human-centered design technology can help center the patient experience, decrease the pressure of human care systems while improving both patients and the provider's experience. According to him, a human-centered approach in combination with the technology will help with the quality of professions for improvement of services to the patients.
Technology is of various types. You can have mechanical technology, you can have medical technology, you can have communications technology. You can have technology in terms of the methods that we use to provide care. And that can improve the quality of what we do, can improve the speed of what we do.
Dr. Julius Luchamzi, the Executive Director of Lubaga Hospital, as the technology is important to monitor the quality of service and the turnaround time in healthcare service delivery, here as he tells us more.
Now technology is at the center of everything, because with technology we are able to make the patient experience the best. From the time that you walk into the hospital, you should be able to have a very efficient registration process, the way that you registered in the hospital, the way that your information on the previous visits is integrated and retrieved, so that I don't have to ask you again what are the diseases you're suffering from. It should be already there in the system. The way that you move across every service area in the hospital should be closely monitored, and we know this person has been at this point for 20 minutes. They should be there for 15 instead of 20. And of course, in the way that we do our operations, we have invested heavily in contemporary surgical services. We are able to do what we call minimal access surgery, or you can call it keyhole surgery. We are able to undertake surgeries without making the traditional cuts.
However, some of the challenges that come with leveraging technology to deliver quality patient-centered care in Uganda are digital illiteracy and high costs attached to the technologies used.
With every technology that you bring on board, the cost goes up. Every time you buy good software to ease patient processes, the cost goes up. Every time you buy a machine that is high-tech, the cost of services go up. So balancing between quality and cost has always been a problem, because our people want quality services, but at the same time, they don't have enough money to afford it. So the biggest problem that we have is to balance to get that balance right. Cost versus quality. To have something for everyone, all right? To have a service for everyone. The low middle income, and then the high income categories should be able to come and access care.
Dr. Bildad Baguma, the Executive Director, Joint Medical Stores, says it's important to harness technologies of high quality at an affordable cost to build efficiency and provide a holistic care in the systems.
And in this digital era, we are committed and will continue to do a number of things that would enable our facilities to be state-of-the-art, including ensuring that people can get equipment, high-value, high-level equipment, and that they can be used harnessing technology to ensure, for example, if they need to get radiologists, they can get radiology by, remotely, without necessarily having, each hospital to employ its own radiologists. We are working on ensuring that our facilities can access internet so that they are able to report, we're able to link up, know what they need, and provide it to them. In so doing, our purpose is to build efficiency in these systems so that we can provide holistic care to our patients.
When we look at technologies to improve healthcare access, first that comes to mind is teleradiology. Teleradiology allows a radiographer at the hospital to take a medical image. Think about it as an X-ray. They take this X-ray, it could be any time of the day, it could be any day of the week, even Sunday, and then this image is uploaded onto our teleradiology platform. It requires a specialized platform because to interpret these medical images, it requires maintenance of the integrity of this picture. So we use this platform that we install free of charge at all facilities with digital medical imaging units, and then we connect them to radiologists both in Uganda and overseas who interpret these medical images and share a consultative radiologist report within 1 hour for urgent cases and within 2 hours for routine cases.
The conference will also continue with constructive engagement and partnerships with all stakeholders to ensure quality healthcare to the people of Uganda. Nora Osende, UCTV News.